Okay, thank you for bearing with me. Good morning once again. Thank you for joining us. Today's webinar is entitled Voice Your Vision, Facilitator Training. Today's webinar is hosted by the New York Department of Health, Office of Minority Health and Disparities Prevention. Again, my name is Harrison Moss, and I'm the Director of the State Partnership Initiative with the same office. Before we started, I'd just like to go over a few housekeeping items. If questions, you'll have the opportunity to submit them at any time during the presentation. Simply type your questions in either the chat box or the Q&A box on the right side of your screen, and collect these questions and address them during the question and answer session at the end of today's presentation. We'd love to hear from you. Today's presentation is also being recorded, and we'll email you a link following the presentation to that recording. We'll also email you the slide deck for future reference. To minimize background noise, we've placed your phones on mute. We'll mute your phones at the end of the presentation for Q&A and discussion. So I just want to open with a quote, and this is from Dr. Margaret Wheatley, and she said, "Listening is such a simple act. It requires us to be present and practice. We don't have to do anything else. We don't have to advise or coach or advise. We just need to share and listen." And the quote was really powerful because it points out the fact that it's such a simple act, but it's also powerful. It gives voice to communities who may not have felt they had a say or a voice, or experienced thoughts or perspectives mattered. This fosters authentic community conversations about what matters to them and why. And understanding this can really help ensure that our communities receive the respect and support they need, as needed, and how they want it. So for those reasons, I'd like to sincerely thank the United Way of the New York State and our community partners for partnering us in this effort, in this Voice Your Vision effort, and for your commitment to give voice to underserved and racially, ethnically, and culturally diverse communities across the state. We're really thrilled to partner with you. On that note, today, we're going to talk about three things: voice your vision, what's purpose, and how does it matter in advancing health equity and reducing health disparities. Number, we're going to talk about what is facilitation, what does a facilitator do, and what is the key responsibility of a facilitator. And third, what are some facilitation skills and tools that you can use to facilitate authentic community conversations. So I'd like to introduce our presenter for today, Yvonne Graham, who is the New York State Department of Health Associate Commissioner and also the Director of the Office of Minority Health and Health Disparities Prevention. Mute you.
We provide. Harrison, can you hear me?
So I just unmuted you, so I'm going to advance to the next slide, and if you start again.
Okay, sure.
Thank you.
So good morning, everyone, and Happy New Year to you. Let me also say how excited we are at the Office of Minority Health and Health Disparities Prevention about the opportunity to partner with you. I'm sure will be of great benefit as we strive to improve the quality of the services we provide and improve the lives of those we serve. So I will begin with the concept of voice your vision. So voice your vision. Voice vision is a community engagement process with the specific purpose of working with communities to give their insight into shaping decisions and actions in relation to identification of priorities, in relation to a specific problem, an opportunity, or an outcome. Next slide. of Voice Your Vision is to obtain public feedback on communities' concerns and aspirations for healthcare system and related services can best serve their needs. We conducted Voice Your Vision sessions across the state of New York and have been inspired by the enthusiasm, in-depth understanding that communities have about their priorities and their insights into strategies to improve their health and well-being. So we thought that this was an excellent opportunity to use this mechanism as a way to improve community health and well-being. Next slide. Again, the aim is to provide information to assist in understanding the problem and reason for engagement, for a process where the community's concerns and aspirations can be articulated, understood, and most importantly, considered, and incorporate the advice and recommendations that we get from communities into decision-making to the extent possible. And as we're doing this Voice Your Vision training, I'm really inspired about this third area to incorporate advice and recommendations, because most recently, this past summer, the department engaged in a series of community-based engagement sessions as we try to strengthen the care infrastructure, and we're now in the process of reporting back to communities about the advice and the recommendations they made and how that is going to guide us as we move forward. So rest assured that when we do these community engagement sessions, the recommendations that we get from communities is important as the community engagement sessions, and feedback to them is a critical issue. Next slide. So voice your vision. The goal is to provide the highest quality healthcare service to residents in a particular geographic area or a community. The process we use is to convene community-based stakeholder meetings to gain input on what specific general services, to determine what works, what doesn't, and the hopes and aspirations are for a service delivery system that addresses the needs of the community. Research is now pointing to the importance of community input into the planning and design of services to meet their needs. These people who live in their communities beyond the 9 to 5 that many of us as service providers are engaged in those communities, so involving them makes perfect sense. So we hope that what we gain from communities can inform the development of targeted interventions to improve service delivery and community health and well-being, and also to set benchmarks for community health improvement. Next slide. So what we hope to achieve? Long term, we hope that we achieve systemic changes that will be sustainable and that will improve the quality and efficiency of care and patient outcomes. We hope to expand healthcare access and address the social determinants that influence health outcomes, such as housing, education, access to healthy foods, etc., and engaging community residents into an identification and priority setting is the way to go if we're to achieve our long-term goals. Next slide. As you know, and I'm sure many of you are familiar with this slide, health outcomes are shaped by a wider set of forces. Outcomes are influenced by a complex array of intervening variables at the individual level, the area in red, at the neighborhood level, and at the institution level. And the literature tells us that the circumstances in which people are born, grow up, live, work, and age, as well as the systems that are put in place to deal with illnesses, refer to social determinants, have considerable impact on health. So we engage communities. We also want to make sure that we incorporate all of these various aspects of their lives that influence their health and well-being. Voice Your Vision community engagement meetings, which we're excited about, will take place from January 1 to March 1, 2017. They will convene in what we call Section 240 minority areas, which are areas across the state that have a 40% or greater non-white population. The approach that we will use is to engage in dialogue with community residents about, one, how they identify and define health and related challenges in their community. Two, the concept of healthy and vibrant community, which will surprise us all. Three, how the healthcare delivery and other services can enhance to ultimately improve community health and well-being. Slide. With to the structure of the session, they were facilitated by community members, guided by the principles of inclusiveness, mutual respect, and cultural appropriateness. We'll provide basic information about the reason for the session. Facilitators will build rapport, structure discussion by using probing and clarifying questions, and more importantly, manage time because we're working within a restricted time frame. And writing and note-taking by scribes to capture the essence of the discussion. So on to the actual process of facilitation. And the definition of facilitate, as we know, is to make easy or to ease a process. What a facilitator does is plan, guide, manage a group event to ensure that the group's objectives are met effectively with clear thinking, participation, and buy-in from everyone who is involved. Slide. The key responsibility of a facilitator is to create a group process and an environment in which it can flourish. So help the group reach a successful decision, solution, or conclusion. Next slide. And many of you are experts at this, but to begin any session, we break the ice. Do that by giving a warm welcome, using terms such as we want your ideas, want to understand your feelings about your experience, your recommendations about how to improve services. And I have to tell you that in the sessions that we held, many community residents were looking for us service providers and as policymakers to say what we're going to do for them or how we're going to work with them. So it's very strange to them when we said, no, we're here to listen. We want to hear from you. We want to understand your feelings. And did they open up? So impart to them that it's not a test. There are no wrong or right answers. Their names will not be shared. We will maintain confidentiality, but we'll track responses from the group because we're going to be using those responses to design services. And they're going to ask everyone to introduce him or herself and, use first names so people can feel very comfortable, and then pose some kind of warm-up questions to start the dialogue going. Next slide. So the skills of a facilitator. One, to build rapport, make people feel comfortable, that you're there to work with them. You're viewing them as experts. You want to hear from them. They're the ones experiencing the issues. They're the ones that will benefit from the success. And so we want to view them as experts. And then balance rapport with professionalism. You don't want to be too laid back, but at the same time, you don't want to be too strict. So contribution, which is very important because everyone who says something says it for a reason and you want to acknowledge that. Next slide. Next, listen carefully. And I know that Harrison started out by giving that wonderful quote about listening. Remain as neutral and impartial as possible. Do not impose your judgment. Give information and use probing, clarifying, and open-ended questions such as, tell me more. Tell about your experience. What did that mean to you? What would you like to see? Next slide. Situations, how to manage difficult situations. And this is always very key. If someone is dominating, you can say things like, I really appreciate your comments. Let's have a variety of perspectives on the issue and hear from someone else. Adding a non-participant. The next question to someone who has not been participating, or ask, what do you think? If one is responding, to ask a question in a different way. If someone goes off topic, they say, thank you, that's a good subject for another session, but now let us see how everyone else feels about this topic. And so if we're having side conversations, respectfully remind people of the ground rules so that we can accomplish the task. Next slide. Time management. It's an agreement at the outset of the amount of time that will be spent on the topic. Group in such a way that you elicit responses only to the questions asked. Discussion moving. And time to time ask participants how they're doing with time without appearing rushed. Next slide. It's about probing questions and breaking the ice. And here are some samples of table topics that can be used. You may want to talk about spirituality and health, chronic disease that they see as priority areas for them, issues, women's health, men's health, social services, preventive health, cultural language, health, senior services, mental health, violence and trauma, LGBTQ health, and of course, you are more familiar with the constituents that you serve, so you also have a sense of some of the areas that are of concern to those communities, and you can change around these topics in any format that you wish. Next slide. So as I end, because I want to make sure we have enough time for question and answers, so key summary points. The facilitator distinguishes process and content. You are there not to provide content, but to manage the process. The content will come from the community resident. Use time and space intentionally. Facilitator should be skilled at evoking participation and creativity. Always affirm the group's wisdom. They know best. They provide the answers. The facilitator should be capable of maintaining objectivity, not imposing your judgment. Be skilled in reading the underlying dynamics of the group. To the situation, demonstrate professionalism, self-evidence, and authenticity. Because the authenticity is key because people can always read through you. They will always know if you're interested, if you really want their input. So demonstrating authenticity is extremely important. And of course, also maintain personal integrity. I believe, is the final slide. So the characteristics, again, of a facilitator is to rather than tell, initiate the conversation, ask for others' opinions, initiate rather than dictate decision-making, without interrupting, able to remain restrained when necessary, look someone in the eye when talking to them, more enthusiastic than systematic, be more counselor than a sergeant. You want people to feel relaxed. Be a coach than a scientist, and draw energy from outside yourself than within. And I believe this is the last slide, and Harrison, you will take over from here.
Thanks so much, Yvonne. We're now going to begin the question, answer, and discussion phase. So I'm now going to take everybody off mute and also check to see if we received any questions in the chat box. The question comes from Orville, who asks, do you recommend having questions written for facilitators to use in case they lose focus or the group gets sidetracked?
Actually, yes. We in prior community engagement meetings, we prepared a set of questions. We always had those questions, but I have to tell you, the community engagement is such a dynamic and exciting process that we've never had to use those questions. But I do recommend that you have the questions in case you have to use them to stimulate conversation.
Give me a second. I'm just going to unmute everyone's phone. 1 second.
Sure.
Is it a possibility to get those questions that were prepared but not used just in case, so we don't need to reinvent the wheel? And also the ground rules as well.
This is Yvonne. Yes, we could prepare some questions for you.
Thanks.
This is Kristen Polino. I'm the Deputy Director with the Office of Minority Health and Health Disparities Prevention. I just wanted to say that in addition to what Yvonne just indicated, we'll have that sample set of questions. We also have, ground rules are more of an outline of what a safe space is, and I think those are going to be critical in opening the discussion when you have the community conversation, when you're setting the tone for the day. It outlines the respect that we are giving to the community, as well as what we expect each individual community member to share with the others in the room. So we will make sure that you all get those and encourage you when you're opening your session to review those or have them posted in the room or on the table.
Hello.
Yes.
This is Sharon in Syracuse.
Hi, Sharon.
So we're having a pretty big group of people, envisioning breaking people into smaller groups to have conversation, or is this more of an audience? What has done in the past that you think has been most effective?
Yvonne?
Yes.
Yes. We've done it in a variety of ways. With a large group, you can use top areas. You can feel free to move from room to room or table to table and surround if they want to be part of more than one discussion group. No. So it's a very open. You want to organize it. Kristen, do you have anything to add based on those that you've attended?
Absolutely. So there have been several different models that are used, and we understand that each will be applied to the community based on their dynamics. But in general, the format would be to have a general opening session where everybody is there to review those ground rules and what the expectations of they are, and to thank participants for coming to reiterate that we're there to listen. And whether it be rooms or tables by topic, you know, inform them they can go to whichever area, and as Yvonne said, feel free to move about and share their opinions on the topics and have conversations. And then at the end, just pulling everyone together again, and then recapping, maybe even highlighting some of the things that were heard, getting community investment or vetting rather of the information that was captured, and thanking them again for the opportunity to sit and actually listen to them, and informing them again that the information is really critical. We could have only received it from them, and that we do plan to utilize that to inform what we do to provide the best possible resources.
Thank you.
Do we have questions, comments?
This is Sharon again. So we definitely envision the community that we, serve quite a bit, and it is the absolute community that you're describing. There are going to be 2 in Syracuse. The other is going to be a Spanish-only session for Latino communities, and we're going to do it all the same day. My question is, as we move forward, we're dealing with a very slow community without any kind of government initiative. You get our information, and then what happens with it? And I hear that it's going to be used to shape how we provide service. But is there any more detail that I can give our community about actually how what they provide is going to affect them in the near future?
Actually, this is Yvonne. Actually,
yeah.
What we've done is the information that we've gathered, we vetted it back to the community so that they can say, this is what, when we say this is what we heard, we correct.
Okay.
So that they feel a part of it. Or you can, organize a group if that's large, maybe someone who represents each area, and to make sure that at the end of the process, you go to them. Say, this is how we're using your recommendations. This is your recommendations have helped. So community engagement it's not just one encounter, but at least 2 encounters to the process. The
Yvonne,
information, the vetting back, and the recommendation.
And so for transparency to our community when we present this, how long typically has it taken to get that information back so we can have follow-up?
It depends on, if you have to go through, for example, we're dealing with a huge bureaucracy. And so it takes much longer than if you're dealing with a community-based organization. So what makes sense is for you to make sure that you have scribes and that you take good notes so you can turn around a report or a transcript very quickly so you can vet it back to that community. Any ways that you can do that, you can probably ask for volunteers in that large meeting of people who would be available to review what you're going to feed back to them to make sure that it's correct.
And Kristen, I just want to add that Paris and I have been meeting, and we have templates with regard to reports that we are going to ask that each of you submit at the close of your sessions. So we're going to allow you to utilize that format to kind of use that back and then submit that to us. I think that validates to the community their purpose for being there. But from an internal perspective, as far as what we as an office also plan to do, we have a great number of minority areas across the state, and this partnership with you is really allowing us to move beyond the quantitative data that we have on the health outcomes of these communities and the demographic profiles, and gather the qualitative information that we really need to inform our own programmatic and grant funding activities and resource deployment as a department. We're engaging our partners across the department to say, you know, these are, yes, here we have the quantitative data, here's what health outcomes look like for this community, but this is what the community is saying their priorities are. It moves beyond just internal department partnerships, but we're working with other agencies as well in the state to look at how we can collectively collaborate towards addressing social determinants. So one of the things that we have been doing is using some of the information to how we as an office develop our future funding opportunities. What organizations do we need to partner with, and what services do they need to provide in order to respond to those priorities that the community identified, and that we're encouraging across the state.
And this is Sharon. One last question. Of course, I anticipate some angst or question come up about the Affordable Care Act. And if you can just, and I'm not looking for an answer today, but if you could just provide us with some kind of statement from the administration regarding New York State's position, that would be great.
Yep, we'll send a note out to our public affairs group to see if they can release a statement for us that we can share with everyone. Absolutely.
Great.
Hi, this is Rita from Syracuse too. Going back to the reporting format, our session is the one that's going to be all in Spanish, so we're going to have to translate all of the captured information so that you can understand it. And as we report back to you, do you have like a time frame through, once we do our session, what's the time that we have to present this report back to you?
Rita, this is Harrison. As far as the deliverable of the report, we would need that submitted to us and approved by March 31st.
By March 31st, okay.
Yeah, and that's also the due date for your final vouchers as well. But we'd likely to, probably a week or two before, which will give us enough time to review, process, and get you paid.
Okay.
Way.
Yes, great, thank you. And then also one last question. So you gave us a table of samples of that we can use to promote the conversation. But is there anything besides that list that you to see in our conversation with the community?
This is Kristen. I would just say that some of these topics that came up were from our original series, and which started out, the first one we did was in Buffalo, and what our organization that we partner with in Buffalo did was kind of, put pavement out in the community and ask community members what they'd like to talk about, and started building. So you can, if you have the opportunity to talk to individuals in the community to see if there's anything else they'd like to be addressed, know what your parameters look like for staffing and for time. But the other thing is that one of our sessions allowed for an open table that could just go to. If they had concerns or thoughts or ideas that they didn't feel fit any of the existing table topics, they were allowed to go there and just talk about those ideas.
Okay. All right, that makes sense. Thank you. Thank you very much.
You're welcome.
Susan, that came in from the staff from Peyton, who asked, after the last Voice Your Vision session, participants wanted to know what went afterwards. What are your plans to move forward? I know a report was supposed to be generated by the task force, but what happened after the report was submitted?
So I think that's in response to the Buffalo, Rochester, and Albany Voice Your Vision sessions, which were co-hosted by, they were facilitated by the Minority Health Council, supported by the office. Those reports, individual community report, was added back to the community and then submitted to the council, who prepared a report of recommendations to the commissioner. They are currently going through the internal review process. Receive them. Our hope is that he will announce those as a public document, and then we will be able to release that and go back to look at, again, as I said, resources.
I did this, Yvonne. I did mention before that your process takes a shorter time, but the reason why this has taken so long is that we're dealing with a huge bureaucracy, and so it had to go through several different steps. But we're in the final steps, so we're hoping that report should be released soon.
Are there any questions from the phone or on chat? Oh, there's one from Payne who asked, will there be a session to let the community members know how you will proceed?
Harrison?
Yes.
This is Mary Ann from the United Way of Westchester and Putnam. And thank you so much for the training session. One question that probably will be asked of us is, yes, we do understand that the listening session reporting will be submitted to you, and also that it will come back to us. But also, in what you have done in the prior sessions, are there any policy changes or important activities or things that have come out that will be informed back to the community, not only that the reports and they become public documents, but also what is happening with, what else is happening with this?
If I may give you an example, last summer, the governor invested $700 million in the healthcare infrastructure in North and Central Brooklyn, where 5 hospitals that almost on life support need critical help. And so they decided that they would host community-based sessions alongside the hospital sessions from providers, what would work and what would not work. And they also did community-based sessions. And in the report, which was commissioned, the department commissioned North, which is a former LIJ, North Island LIJ, they did the report, and it's online. And you could even look at that report to see how well the community recommendations were crafted into what new healthcare system would look like. And we're now in the process of holding those follow-up meetings to report back to the community to show them how their recommendations will be used.
I'll repeat the name of the report.
It's I have to look. I will ask Harrison to send you the exact name so you can find it on the website.
Thank you.
And again, I just want to add that one of the project now exactly what we will do until we hear from the communities. So we heard in Buffalo, Albany, and Rochester that communities felt extremely empowered at the opportunity, and they felt the establishment of a trust relationship. And it was all set by the tone of the partners and the representatives that attended the sessions. And over and over again, you have to come back. You have to come back to the community. You have to continue to hear from us. You have to provide us with these opportunities to continue talking. We want to be a part of the process. So one of the things this office has been committed to establishing is the ability and mechanism to go back into those communities to continue to support the sessions and development of community priority action and sustainability plans. We'd initiate a funding opportunity for Albany, Buffalo, and Rochester. Unfortunately, we didn't have a high response as far as applicants, so we are still looking at how we can incorporate that work and who it is that we need to partner with to continue that. But we are committed as an office to that process and have been in touch with those communities. So I think Harrison and Yvonne both indicated early in the discussion how excited we are to partner with you, and we respect that partnership with you as well. We understand that you're the ones that are going to be out there with the community. we will make sure that we maintain communication with you, that we talk to you as we move forward with any plans that we have as far as how to respond to the priorities that are set, that you do discover through this process. I encourage you to look at other partners. Once you have this information, you can share it in the community as well with others that could perhaps address some of the gaps, provide some of the supports the community is looking for. I just want to assure you that we understand the dynamic. We've done several across the state, several larger initiatives going on with the First Nations across the state. We really do respect the position that you are taking and going out to these communities, and we're committed to a partnership with you.
This is Sharon again. So we have some groups in our community, Black Nurses Association, Black Nurses Rock, some kind of grassroots groups of Black professionals. Discourage their participation, or do you encourage professional participation, or do you really want it neighborhood level folks?
Many people who are providers also live in communities, and are consumers of services. So from that perspective, they can participate that way.
You want to make sure you have a cross section, though. You need to make sure that you're overly, you're overly professional. But you also approach them as partners. Maybe they can be the scribes, or maybe they can be there to help foster those conversations. But you really do want to get to the community member perspective.
I was thinking more so of bringing them in as and helping to facilitate the function. So, yeah, they're also great points. Thank you.
Do we have other questions? I'd like to thank all of you for attending today's webinar, Voice Your Vision Facilitator Training. For follow-up, I know that you've requested the ground rules, some simple questions, a statement on the Affordable Care Act, and also the link to the Brooklyn report that was produced as a result of community engagement sessions conducted down there. So I'll send those to you today. Also, as mentioned, this webinar has been recorded, and I'll do an email with a link to view the recording of today's webinar so you can share it with those who make it, or if you'd like to watch it again. On behalf of the Office of Minority Health and Health Disparities Prevention, we thank you again for joining us today, and have a great rest of your day.
Thank you.
Thank you.
Thank you.
Thank you.